Hi, this is Kiran, CRC and Citizen Certified. Here I am going to explain about the conventions. In ICD-10 CM, these conventions as a set of rules. So I will explain one by one here. Based on the rule, I will divide it into three types. First one is the condition with specificity, and the second one two conditions, and third one multiple conditions. So here first I will go by condition with specificity. Where a condition having specification, these conventions will use. For example, asthma having specifications, but HIV or AIDS is not having specification. So these conventions are only applicable for asthma, not for HIV or AIDS. Okay. And then based on this, we have two conventions. First one is NAC and second one is NOS. NAC abbreviation is not elsewhere specified or classified. Other name is other specified. For example, where the provider mentioned specification of the condition which is not fall in the conditions specification, which leads to specified NAC. For example, the provider stated that inflammatory acne. Okay, I will go. I said it in CM. Under acne, under acne, we don't have the inflammatory specification. So here we have to go by the specified NAC. So at this time we have to use the NAC. The next one is NOS, not otherwise specified. The other name is unspecified, where the provider didn't mention the specification of the condition. It leads to unspecified. For example, the provider stated the patient having asthma. Here, if lead under asthma. Under asthma, we have number of specifications, but the provider mentioned only asthma. So here we have to go by the unspecified asthma. This is called NOS. Here the next conventions are exclude one and exclude two. When we have to use these excludes, where the provider mentioned two conditions, we have to follow. Okay, here exclude one. If provider documented two conditions in a report, but the conditions can't occur together, so we have used this convention to follow at this time. For example, the provider stated the patient having HIV and AIDS in a report. In ICD, we have exclude one for these two conditions. So at this time, we have to go by the B20 because the AIDS is the advanced stage of HIV. The next convention is exclude two. The provider documented two conditions in a report. At this time, these two conditions can occur together. So we have to use this convention. For example, the provider stated the patient have the thrombocytosis and the thrombocythemia in a report. At this time, we have exclude two for these conditions. So we have to use both codes at a time. And the next conventions are based on the conditions. Uh, Here we have to use more than one codes to describe more for one condition. The first one is code first. This convention is used for the when the provider mention an etiology and manifestation conditions. Here the etiology means the cause of condition and the manifestation is the complication of condition. For example, the provider stated that patient having the diabetes due to cystic fibrosis in a report. Here, the cystic fibrosis is the cause of the diabetes. So, if we see the E08.9 code in a tabular list, under the category we have code first convention for code first cause of the condition. Here we have to code first for cystic fibrosis, then diabetes mellitus due to the underlying condition. Next one, use additional code. When the provider stated that patient have the Alzheimer's disease in a report. Here the under leading Alzheimer's disease, if we see the G30.9 code in a tabular list on a category, we have convention for use additional code for manifestation condition. Means by default we have to code dementia code also. This is called use additional code. And next one, C. The provider stated that patient having malakoplakia urethra in a report. While leading malakoplakia. Malakoplakia. Here it shows C. Malakoplakia. Under malakoplakia, we have urethra N36.8. These codes to use for this. This is conventions for leading. That's it. If we have any extreme, today we have completed conventions. You got any valuable information from this video. Please like, share, and subscribe. I will come back with a new topic. Thank you for watching my video.